I'll go ahead and start. Hopefully you can see my PowerPoint. But my name is Anupriya Ganguly, and I'm presenting on pre-hypertension and sickle cell disease as a risk factor for apartment visits and hospitalizations. So as an introduction, while there are new approaches in treatment that are improving diagnosis and management of sickle cell disease over the last few decades, many patients still have severe complications, leading to repeat ED visits and hospitalizations. Better risk stratification can help reduce healthcare resource utilization, including ambulatory, emergency department, and inpatient hospitalizations. Individuals with pre-hypertension, hypertension, have higher rates of left ventricular hypertrophy than normotensive patients of the same age. Multiple studies have demonstrated that increased rates of cardiovascular disease and mortality in young people with hypertension. We explored the role of pre-hypertension in African-American hemoglobin SS sickle cell patients in order to risk stratify sickle cell disease and its impact on ED visits and hospitalizations. Methods. This is a retrospective review that includes 100 African-American hemoglobin SS sickle cell patients with sickle cell disease from 2021 to 2022 at a single urban US-based safety net medical center. Information was extracted and included demographics such as age, sex, BMI, baseline hemoglobin, baseline blood pressure, sickle cell disease characteristics, and number of ED visits and admissions in the last 12 months. 25 patients were excluded because of having other hemoglobinopathies, and de-identified data was compiled into a descriptive table to determine whether blood pressure affected hospital visits and admissions. Patients with hemoglobin greater than 10 and blood pressure less than 120/80 served as controls from which relative risk of ED visits and hospital admissions were compared to determine the risk of systolic blood pressure, diastolic blood pressure, and pre-hypertension, and the role they played in ED visits and hospitalizations. Results. Our cohort included 75 African-American patients with hemoglobin SS genotype, 100% were publicly insured. The average age was 35, with 39 females and 36 males. And average BMI was 25, with an average hemoglobin, baseline hemoglobin of 9. The average number of ED visits or hospital admissions was 4.8 in the last 12 months. And the severity of anemia was the largest risk factor for admissions, with hemoglobin less than 10 leading to 5.8 admissions versus hemoglobin greater than 10 having only 2.4 admissions. Within the cohort of patients with hemoglobin greater than 10, normotensive patients had 1.1 admissions per year. Pre-hypertensive patients had 9.7 admissions per year. And for patients with hypertension, there were 14.7 admissions. For elevated systolic blood pressure greater than 120 or diastolic blood pressure greater than 80, the relative risk for hospital admissions ranged from 2.4 to 7.9 based on their hemoglobin. For hypertensive patients with hemoglobin less than 10, the relative risk was 12.7. Okay, so this is kind of summarizing. In conclusion, patients with hemoglobin less than 10 had overall more hospital admissions and ED visits than those with hemoglobin greater than 10. For both cohorts, the relative risk of hospital admissions and ED visits was higher for patients with either elevated systolic blood pressure, diastolic blood pressure, or pre-hypertension. Pre-hypertension with hemoglobin less than 10 had almost 10 times the relative risk of admissions compared to the control group of normotensive patients with hemoglobin greater than 10. Results are limited because this is a small sample size, but consistently shows that pre-hypertension in this overall young cohort of patients is a risk factor for ED visits and admissions. And our take-home points, basically, pre-hypertensive sickle cell disease patients with hemoglobin less than 10 have 10 times relative risk compared to control group of normotensive patients and hemoglobin greater than 10 in terms of ED visits and hospital admissions. Screening for pre-hypertension can alert physicians to patients who may be higher risk for repeat admissions, either because of pain or disease control perspective. And then further research is warranted on identifying whether blood pressure is a predictive risk factor for admissions in sickle cell disease, as adequate attention and treatment may reduce acute care utilization in this population. That's all, and if you have questions, let me know.